So what's the problem? Too much demand and the healthcare industry just isn't keeping up. The key issues plaguing the Canadian healthcare system include inconsistent EMR systems, which promote inefficiencies, lack of availability of healthcare services, accessibility to shared data, rising costs, and patient and confidentiality issues. That's why we're here to introduce our proposed digital business model to address this serious and growing concern that the healthcare industry is facing. MediBands, with an integrated province-wide EMR system on a hybrid cloud platform and integrated e-prescriptions. The solutions EMR model will include increased efficiency to reduce costs and increasing security and accessibility across the entire province.
MediBands use radio frequency identification technology to communicate crucial information to identify and connect patients, caregivers, equipment, location, and procedures for efficiency, cost savings, and patient safety. Crucial patient information can be instantly accessed on devices in the room that the patient is in with no need to physically move the patient, allowing for a more efficient process. Similar RFID chips will be used to track supplies and keep accurate inventory data to allow for optimal order quantities, therefore reducing costs spent on overstocking. Our MediBands will also utilize automation to digitize and streamline the journey by pulling up patient data as they enter different clinics within the hospital. It will also prioritize patients to help with patient flow, reducing costs and creating synergies. Using proactive personalization, the data stored on the hybrid cloud from the MediBand will have a recommendation engine that uses an intelligent reordering algorithm to recommend the proper medication while taking into consideration allergies and family history. Indirect and direct costs of implementing our plan include, but are not limited to, establishing the EMR system, developing the MediBand technology, establishing proper training programs and help desks, and hiring professionals to fill necessary but currently vacant health system information management and IT positions within the Ministry of Health and Long-Term Care. However, these costs will translate into increased efficiencies, reducing costs in the long run and increasing revenue. With regards to implementation, we plan to introduce a pilot program incorporating MediBands and the EMR system at the University Health Network in Toronto, Ontario. We will phase the pilot out into other research-oriented, technologically advanced hospitals across Ontario. Following the successful implementation in hospitals, the EMR system will then be introduced to other healthcare providers such as family physicians and walk-in clinics, with completion of introduction expected by 2030. By using an iterative development approach, we allow for flexibility and change to be made with regards to successive iterations based on user feedback prior to the project being phased out province-wide.
Accessibility, efficiency, confidentiality.
Choose MediBands.